Okay, Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, everyone. We are from SKBSK, and today we will be presenting about the computed tomography during COVID-19 and the importance of CT scan during this pandemic. So, first of all, let's dive into the introduction of the background and function of the CT scan. So, for the introduction, CT scan is a medical imaging procedure that uses computer processed combinations of many X-ray measurements taken from different angles to produce cross-sectional images of specific areas of scanned object, allowing the user to see inside the object without any cutting. So, as you see here below, they use the combination of the discovery of X-rays along with the mathematical algorithm, and then they came up with the CT scan. This CT scan might cause some harm because it emits ionizing radiation with the atom, where electrons are removed and converted into ions. So here we come to the boring part, but it's important to know how this device came into existence. So for the history, in the early 1900, an Italian radiologist, Alessandro, invented the tomography, which used radiographic film to see a single slice only of the body. Then in 1967, Godfrey or Hounsfield invented the first CT scanner at EMI Central Research Laboratories using X-ray technology. In 1971, the first patient brain CT scan was performed in England. In 1973, the first CT scanners were installed in America. By 1980s, 3 million CT examinations had been performed. By 2005. That number had grown to over 68 million CT scans annually. During the 90s, portable mobile CT scanners grew in popularity, and by 2005, 90% of PET scanners were actually PET CT scan fusion. They mixed the PET with the CT scan imaging scanners. Then the latest one, which is by 2008, a new CT scan generation was developed, which could take images of beating hearts or coronary arteries in less than 1 second. Imagine, in just less than 1 second. So next, we go to the anatomy or the elements of the CT scan and its functions. As you see here on the right side, there is a picture which consists of the gantry, the patient table, and the gantry apertures. The tube inside produces the X-ray radiation that passes through the body, which usually has a rotating anode and is capable of withstanding the high heat loads generated during rapid multiple slice acquisition. The fan beam emits the X-ray and is detected by a linear detector array. Then we move on to that detector, which is opposite to the source. The detector is made of ceramic material that measures the amount of X-ray radiation going through different organs. When exposed to ionizing radiation, silicon photodiodes convert that light into an electrical signal. Then the electrical signals are then collected and stored in computer as scanned data. For the table here, or the patient table, is for the coordination of the patient into or out of the gantry, as well as to elevate up or down. For the laser, as you see here also, the picture on the right, the laser is used to align the vertical and horizontal position of the body part. Another thing is the computer, which is used to reassemble. Imagine a lot of pictures are assembled through the algorithm or through the computer and reconstruct the data collected by the detectors using mathematical algorithms. The computer will produce digital images, also called 3D volumes. The radiographer uses software that automatically assigns Hounsfield unit value between -1000 to 1000. And I will explain this further in the coming slide. For every voxel, and voxel is some kind of pixels of the CT image. So for the Hounsfield units, as you see here, let me annotate. For the Hounsfield unit, as you see here, for the -1000 indicates this area is filled with air. Imagine the cavities or the areas or the holes of the lungs are filled with area. That's why in images we get dark colors. Whereas on the right hand side is 1000 plus 1000, which indicates bones, and also greater than 1000 indicates there is a metal or something has higher density. And in the middle, the 0 indicates the water. Okay, for the diagnosis, what does CT scan diagnose? And today we are coming to talk further about the CT scan in terms of COVID-19. First of all, let's understand and get to know few diagnoses. Then we'll go deeper into the CT scan and its function with respect to the COVID-19. First of all is the CT scan with the head or the CT scan head. If there is any bleeding or blood clot, as you see here in this image, this yellow color indicates that there is a clot or a bleeding inside the brain or inside the head. And second, the brain injury and skull fracture, if there is any fracture. And lastly, the brain tumors. Brain tumors could be detected through the CT scan as well. Second is the CT scan for chest. And this is the one which we will dive into more. The first for respiratory, cardiovascular, intrathoracic, obstructions, and so on. The third is the CT scan for the abdomen, organs inside the abdomen. The abdomen is actually our stomach or the area of the stomach, which may be affected by cancer or infection, perforation, and trauma. And by the way, perforation is the puncture or the hole inside. Lastly is the CT scan spine to provide information about the vertebra or our backbone, about the vertebra and other spinal structures and tissue. As you see here, the yellow arrow indicates that there is a puncture or they inserted a needle, and this yellowish or the yellow color indicates the bone. As I explained earlier, that bone is indicated by a brighter color. Yeah. Then for the generations, actually for CT scan we have 5 generations, but for the current use we only use these 4. The first generation and the first and the second generation are almost the same, but the difference is only in the detectors. In the second generation, this second one, there are multiple detectors. But let's see the first generation. The first generation is called translate and rotate. And we mean by translate and rotate, translate is for the source and rotate is for the detector, which is opposite to the source. So the first generation, the beam is picked up by a single detector, which is opposite to the source. Then the source and detector move together, which is the action called translate. The two rotate together to image a different angle, and this usually takes 5 minutes per slice. Imagine this, the first generation was taking 5 minutes per only a slice. Imagine if for only one organ, hundreds of images will be taken. So how long would it take? For the second generation, they improved to multiple detectors. So the second generation, the only difference from the earlier one is the multiple detectors. For the third generation, called rotate, and here the source and detector all rotate together. As you see here also, they improve the detectors to multiple detectors. And here the beam hits a row of detectors. There are a lot of detectors wide enough to image the whole slice. Imagine now, a lot of slices are taking with less time. The two rotate together to image a different angle. The detector array is continually moved down the patient as it rotates. It's the action called spiral scanning. And see, the time is lessened by a bigger factor. As you see here, most common is 0.3 seconds per slice. So if you compare to the first generation, it's a huge. The fourth generation, it's not commonly used, which called the ring of detectors, where the source rotate and the detectors are fixed. So the a fixed complete ring of detectors along the circle are a lot of detectors. Then the second, the X-ray source rotates around the detectors to capture the slice. Then thirdly, both move down the patient to begin imaging a different slice. And now let's see a short video of how does this machine work or operate.
A CT scan is an X-ray procedure that creates cross-sectional images with the help of computer processing. CT images are more detailed than conventional X-ray images and can reveal bones as well as soft tissue and organs. A conventional X-ray uses a fixed tube that sends X-rays in only one direction, while a CT scanner uses a motorized X-ray source that shoots narrow beams of X-rays as it rotates around the patient. There are special digital X-ray detectors located directly opposite the X-ray source. As the X-ray passes through the patient, they are picked up by the detectors and transmitted to a computer. Image slices can either be displayed individually in two-dimensional form or stacked together to generate a three-dimensional image that can reveal abnormal structures or help the physician plan and monitor treatments.
And now I pass over to Mr. Abdullah.
Okay, thanks, Bilal. Assalamu alaikum and hello, everyone. And thanks for attending our session. Today, I will speak about or talk about the advantages and disadvantages of the CT scan. Next slide, please. Starting with the advantages, CT scan have the highest accuracy in disease diagnosis, since the CT scan have the highest sensitivity and specificity among all imaging modalities. If you don't know that sensitivity and specificity reflect and indicate how the device or the test is accurate. And the CT scan have the sensitivity of 91 to 93% and specificity of 89 to 92, which shows how the CT scan is accurate. Also, for the second one, in which CT scan provide a highly detailed 3D imaging, since as Bilal explained that CT scan is just at the beginning take multi cross-sectional imaging, 2D imaging, and then combining it in the imaging construction into one 3D image. And this gives us another advantage of we can trace any abnormal cells inside the organ. Also, CT scan is a very fast, only take a few minutes. Also, CT scan provide information for both hard and soft tissue at the same time. For all or most of the imaging techniques, only either it will be good on the soft or depicting the soft tissue or the hard tissue. But the CT scan is good at both. Also, since the CT scan is the old technology, it's not a new one. So you will see that it have a high availability among all the world, and you will see it almost in each hospital. Also, CT scan, the cost is a lot cheaper compared to other, compared to all imaging techniques. For the disadvantages, the huge or the biggest disadvantage is the radiation exposure. Since the CT scan, the average amount of the radiation is around 18 to 24 millisievert, and this is a quite huge. So that the pregnant woman cannot go for this test, since this amount of exposure, I mean, of the amount of radiation, may increase the mutation chances in the infant. And also the good news is that nowadays, they reduce or invented a new techniques to reduce the radiation exposure, such as a prospective gating technique. This technique reduced the radiation exposure by 40%. Also, they now improving the CT scan itself as you can see that from the other slides, which Bilal explained, the generation also, they invented and implemented a new another to detect the abnormal cells without depending on the ionizing radiation. Also, for the second disadvantage, which is the contrast related to the contrast agent. As you know that the contrast agent is used to improve the detail of the imaging produced, but some patients show an allergic reaction to this contrast agent. But we are lucky because the allergic reaction is not a severe or deadly, but it's most likely a mild, and it will just stay for 2 to 3 hours, and it's not a big deal. For the third one, also related to the contrast agent, for the patient who have an abnormalities or dysfunction in the kidney, if they go for this test, the contrast agent may worsen their test, so that they don't go for this test. Also, this can be prevented. This accident can be prevented by checking the patient history and by applying the safety procedure as it will be explained by my friend.
Assalamu alaikum. This is Nas Hussein. Today I will present the safety of the CT scan. Mr. Bial, could you click the next slide? Okay, there are many steps. We will start from the preparation. Let's say that you are an example that you have tomorrow an appointment with the CT scan. So your appointment letter will mention anything you need to do to prepare for your scan. You may be advised to avoid eating anything for several hours before taking the scan to make the image clear. You should contact the hospital after receiving your appointment letter if you have any allergies or kidney problems, if you are taking medications for diabetes, or as a special arrangements may be required for you. You should also let the hospital know if you are pregnant. Let's say that you are a woman. CT scans are not usually recommended for pregnant women unless it's an emergency case, as there is a small chance that X-ray could harm the baby. Okay, you should try to avoid wearing clothes or anything containing metals such as zibs, as this will need to be removed. Next slide. Okay, before having the CT scan, there are many steps you have to care about them, which are: before having the CT scan, you may be given a special dye called a contrast to help improve the quality of the image. This may be solved in the form of a drink, or passed into your enema, or injected in blood vessels. Thirdly, tell the radiographer if you feel anxious or claustrophobic about having the scan. They can give you advice to help you feel calm and can arrange for you to have a sedative medication to help you, to make you Relax if it's necessary. Before the scan starts, you may be asked to remove clothes and put on a gown. You will also be asked to remove anything metal such as jewelry, as metal interferes with the scanning equipment. Next slide, please. Thirdly, what happened during CT scan? During CT scan, you usually lie down on your back on a flat bed that is into the CT scanner. The scanner consists of a ring that rotates around small sections of your body as you pass through it. The radiographer will operate the scanner from the next room. While the scan is taking place, you will be able to hear and speak to them through an intercom. While each scan is taken, you will need to lie very still and breathe normally. This ensures that the scan images aren't bothered. You may be asked to breathe in, breathe out, or hold your breath at certain points. The scan will usually take around 10 to 20 minutes, depends on the layers of your body that you will be scanned. Next slide. Okay, what happens afterwards? Okay, you shouldn't experience any after effects from a CT scan, and usually you're back home, or you can eat, drink, and you continue your life normally. If a contrast was used, you may be advised to stay or wait in the hospital for up to an hour to make sure you don't have a reaction to it. The contrast is normally completely harmless and will pass out of your body in your urine. Your scan results won't usually be available immediately. A computer will need to process the information from your scan, which will then be analyzed by a radiologist, specialist in interpreting images of the body. After analyzing the images, the radiologist will write a report and send it to the doctor who referred you for the scan, so they can discuss the results with you. This normally takes a few days, around weeks. Okay, we will go to the question. Are CT scans safe? CT scans are quick, painless, but there is a small risk you could have an allergic reaction to the contrast dye used and you will be exposed to X-ray radiation. The amount of radiation you are exposed to the CT scan varies. It depends on how much of your body is scanned. CT scanners are designed to make sure you are not exposed to unnecessarily high levels. Generally, the amount of the radiation you are exposed to during each scan is the equivalent to between a few months and few years of exposure to natural radiation from the environment. Mr. Bilal, could you open the link? The students of the, no, the link, yep. Okay, could you scroll down? Okay, down a little bit. Okay, for example, if you want to, if you want to do a scan for your chest, the effective dose, it will be 8 millisieverts. That its background will be for 3 to 6 years, and for fatal for the cancer will be 1 in 2,500. In this link, you can read information about the doses, the standard doses, and about the CT scan radiation. My friend Ibrahim will continue about the impact of CT scan during COVID-19.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Ibrahim Adil, and I'll be talking about the importance of CT during COVID-19. So before going too deep inside this topic, we need to just recall what is COVID-19 and what is this disease symptoms, okay? Most people infected with COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission, as you all know, and we all should be doing right now with the lockdown, is will in COVID-19 virus disease it causes and how it spreads. Protect yourself and others from infection by washing your hands or using any alcohol-based rub frequently, and not touching your face, of course. In terms of causes, we all know how it's transformed from one person to another, and I believe no need to talk about this one. In terms of symptoms, okay, in the more fever, dry cough, tiredness, but the less common symptoms, itches and pain, sore throat, diarrhea, and headache, loss of taste or smell, and a rash on skin. And the serious symptoms that some patients may face, and these ones that we will be focusing on mainly: difficulty in breathing or shortness of breath, chest pain or pressure, and loss of speech or movement. Okay, so the difficulty in breathing is a very dangerous part to have on the patient. And we will talk about how the city role in this COVID-19. So in the progression of city abnormalities, sorry, Mr. Bilal, can you go to the next slide? Sorry. The one after this one. Yeah, okay. So in the early phase, multiple small, but now we will be talking about the in each phase how the image will look like and what will affect the image. So in the early phase, no, sorry, the one before it. Progression of CT abnormalities. Yeah. In early phase, multiple small patchy shadows and interstitial changes begin to emerge in the distribution, beginning near the pleura or bronchi rather than the pulmonary bronchomia. In the progressive phase, the lesions enlarge and increase, evolving to multiple ground glass opacities and infiltrating consolidation in both lungs. In the severe phase, a massive pulmonary consolidations occur while pleural effusion is rare. In the dysphasia phase, a ground glass opacities and pulmonary consolidations are absorbed completely. Then the lesions begin evolving into fibrosis. Now, moving on to the CT scan features. As you can see in this image, sorry, Bilal, can you go to the after this slide with next 3 slides? Can you, sorry, please stop sharing and reshare again, because I did some small modifications in the arrangement of the slides. Now we will be talking about the feature that CT scan show in the images. How can we, when we see an image from CT scan, how can we tell whether this image or this lung of this patient has COVID-19 infected or not? There are some features and some aspects that we can, based on, tell whether this patient has a COVID-19 infected lung or not. And now we will be talking about it.
Ibrahim, are you going to share?
Okay. So the first aspect is the dominant distribution. In the image, we can see there is there will be some kind of shadows on the image that will be distributed on the image. And a few seconds we will see an example. And in terms of the quantity of these shadows or these spots on the image, frequently more than 3 or more lesions, occasional single or double lesions. In terms of shape, they look like patchy, large block, nodular, lumpy, honeycomb-like or grid-like, cord-like, and etc. In terms of density, mainly uneven, a paving stone like change mixed with ground glass density and interlamellar special thickening, consolidation and thickened bronchi wall, and etc. And finally, the last aspect that we will be talking about before showing you the image, the concomitant signs that vary, rare pleural effusion and mediastinal lymph nodal enlargement, and etc. So the scans detect hazy, patchy ground glass, white spots in the lung, and now we will see a video that will show us the COVID-19 pneumonia chest CT scan scroll through. Now this is a CT image scan. As you can see, we can see some few shadows that appear on the lung. This is an image, CT scan image of the lung. These shadows are the that prove for us that this lung is affected with COVID-19 or not. To make it clear, now I'll show you another images. Yeah. As you can see in these two images, the image B on the right is an infected image with COVID-19. Actually, these two images were taken from Chinese patients. So these shadows are the shadows that we are talking about, the shadows that represent COVID-19, that this lung is infected with COVID-19. However, the lung on the A side, the left side, sorry, A, is a normal lung. Another example, this one, also the same, another image of another patient of an axial chest CT, demonstrate a patchy ground glass opacities with peripheral distribution. And another example of the same patient, coronary chest CT of the same patient above, showing patchy ground glass opacities. And now this is also a third image to show you the same thing. Now, in terms of detection, actually not only CT scan can detect COVID-19 infection, and mostly if you went to the hospital, and I hope you did not go to the hospital, I hope you are staying safe at home. If you went to the hospital, you can be diagnosed with X-ray. But well, what's the difference if we can diagnose the patient with X-ray and CT scan? So why should we use CT scan? Now we will tell you the difference. Okay, chest CT scan allows for a more detailed view compared to a chest X-ray. For example, a chest X-ray may identify an abnormality, but a chest CT scan should be able to show the exact location and examine the nature of formation. Not only that, in the early stages, mostly X-ray cannot identify, cannot show the image clearly. However, CT scan is capable of doing so. And another difference is the chest X-ray provides a 2D image, while a chest CT scan is able to produce a 3D view of your organs. And finally, an X-ray is able to examine dense tissues, while a CT scan is better capture bones, soft tissues, and blood vessels all at the same time. X-ray is mainly for the hard tissues and bones. So that's why in the soft tissues, X-ray does not show the soft tissues that clearly. Just to sum it up and recall everything, chest CT imaging has a high sensitivity and high NPV for diagnosing COVID-19 and can be considered as an alternative primary screening tool for COVID-19 in epidemic areas. There is another video that will show us the role of CT scan for COVID-19 patients and how to read CT scan reports. Sorry for taking your time, just to watch the video. Can you hear the sound clearly?
Ibrahim, share with sound.
Sorry?
Share with sound. To the option of sharing with sound.
Okay. Okay, now?
The first common question is whether everyone has to undergo medical imaging like CT scan or chest X-ray. And the second question is, what does the CT score means to you? Hi everyone, myself Dr. T. Sitam Kumar, consultant radiologist in Nidan Diagnostic, Bhubaneswar, Odisha. In this pandemic, I am here to clarify few of your doubts regarding medical imaging in COVID-19 infection. The first common question is whether everyone has to undergo medical imaging like CT scan or chest X-ray. And the second question is, what does the CT score means to you? Does everyone has to undergo chest X-ray or CT scan? The answer is absolutely no. In the first few days of symptoms like cough and fever, it is not advisable to undergo chest X-ray or CT scan. The first thing is patient has to be symptomatic like high-grade fever more than 100.4 degree Fahrenheit for few days, not responding to paracetamol, or you are having breathlessness or oxygen saturation in a decreasing trend. And the second indication is there is increasing trend of biochemical inflammatory markers like C-reactive protein, ferritin, D-dimer, interleukin-6, all are in a increasing trend. And the third thing is there is highly suspicious of COVID-19, but in your area RT-PCR is not available or RT-PCR is negative for few incidents. Coming to the second question. So in the CT scan, there is a COVID-19 reporting and data system which called as CORADs. CORADs 1 to 6 depending upon the suspicious of COVID-19 lesions like CORAD 1 normal lungs, CORAD 2 low suspicious, CORAD 3 is intermediate suspicious, CORAD 4 is high suspicious, 5 is very high suspicious, and 6 is PCR positive with COVID-19 lung lesions. So coming to the score, a human body has two lungs, one on right side, another on left side. So right have 3 lobes, left has 2 lobes, and thus each lobe will be given a score from 1 to 5 depending upon the lung involvement. Like 1 is less than 5% involvement, 2 is 5 to 25% involvement, 3 is 25 to 50% involvement, 4 is 50 to 75% involvement, and 5 is more than 75% involvement. So each lobe will be given a score and that will be summated and the score will be given out of 25. So if the score is less than 8, it is mild disease, 8 to 15 is moderate disease, and more than 15 is severe disease. So whatever may be the score, that will be multiplied by 4, which will give rise to the percentage of lung involvement. Like if my score is 9, so there is 36% of lung involvement. Hope I have solved few of your queries regarding
Okay, so that was everything for the CT scan role in COVID-19. Now, to test your understanding and just to have fun a little bit, we will move on to a Kahoot activity and I'll pass it to my friend Bilal now. Thank you so much.
All right. Now let's move on to the most amazing and exciting activity, Kahoot. So we will spend 3 to 5 minutes for the Kahoot. I will share with you the link that you can join through. Please join us for just 5 minutes and let's enjoy this Kahoot activity all together.
What is the pin of the Kahoot?
Yeah, just a second. Okay, here we go. Can you see the game pin?
Yeah.
9877223. I will share in the chat box. Seriously, I didn't expect this big number of participants, almost 30.
Yeah, we appreciate their valuable time.
Join us, guys. Let's see who will be the first and second, third place. Let's see who will win. Okay, we'll start in a minute. How about the rest? Can you join us? Is there any awards or prizes? It's just a matter of competition. Let's see who will compete and get the first place. Let's test our knowledge.
Malik, next semester, inshallah. Yeah, NASSER. Sorry, I can't understand Arabic. What did you say?
Okay, we shall start now. Here we go, guys. The first question. CT scan is a combination of, I explained this one in the first slide. Oh, I can see answers. Okay, let's move on to the second. Oh, the king. Okay, the second. Enjoy. Gantry is? It's clear, guys, right? Only 8? So 2 of you answered none of above, though it's very clear in the picture. Okay, let's move to the third question. The infected lung will appear in CT scan image as? So only 6 of you are focused with the Ibrahim presentation. Okay, let's move on. Joseph is coming up.
Ali.
Advantages CT has is amazing. I can see Joseph is going up. Move on. Okay, true and false. Both of CT scan and X-ray can be used to diagnose COVID-19. True or false? Only 4. All right, move on. CT scan can provide information for what tissue? Is it the heart or the stomach or both? Wow. Nice. 13. Okay. Rouge. Who's a rouge? Okay, rouge at the top. True or false? CT scan can provide 3D images. Okay, amazing guys. Keep moving. Now the 8th question. Also true or false? The patient doesn't need to remove any metal before the CT scan. Is it true or false? Nice. Okay. Rouge at the top. Okay, the 9th question. CT scan usually takes around, is it 1 hour? 0 to 5 minutes? Or 10 to 20 minutes? Okay, the answer is 10 to 20 minutes. Yeah. Okay, the last question. Rouge at the top. Biomedical at the top. The radiographer will operate the scanner from the same room you are in. Nice. 11. Okay, let's see.
Great.
The 3rd place is blue. Second, Joseph. Rouge.
Wow.
Congratulations, guys. And the runners up
Okay, the
are
winners.
Abu Ali and Anas, the 4th and the 5th.
Okay,
Amazing,
the winners. Contact Bilal and
Don't put me in trouble, Nasser. Okay, let's get back to our sharing. So guys, would like to thank you for your participation. That was all from our part. Stay safe, and inshallah we'll meet in the nearest or the soonest session. Until then, we would say Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much, guys.
Thank you so much, guys, for attending this.
Thank you for
Thank you,
attending.
guys.
Really appreciate your time. Thank you so much. And we hope that it was a useful session for you.
Okay, guys, one thing to just remind you, we will share through our group WhatsApp group, We will share a Google form. Just we need your feedback. It wouldn't take more than a minute. So will be appreciated if you can spend just a minute to fill up the Google form. Until that, we see you inshallah in the next session. Assalamu alaikum wa rahmatullahi wa barakatuh.